Good morning, everyone, and thank you for joining us. We will be giving the other attendees a couple of more minutes so that they can enter the webinar before we finally begin the program proper. Again, thank you so much for joining us. This is Leading Insights, Deepening Socioeconomic Recovery from COVID-19 through Innovations in Data and Policy. Good morning, everyone. And again, thank you so much for your patience. We are encountering some technical difficulties in live streaming this activity on Facebook. So we are working on getting us online on Facebook right now. But I guess since all of our panelists and our speakers are already here with us, we shall begin our program. Again, welcome to Leading Insights, Deepening Socioeconomic Recovery from COVID-19 through Innovations in Data and Policy. This webinar is hosted by the United Nations Development Program in the Philippines in partnership with the Zero Extreme Poverty Coalition and the Analytics Association of the Philippines. We are honored and grateful that you have taken the time to join us today. My name is Charlene Balaan of UNDP Philippines, and I'm your host for this morning's webinar. Today, we will unpack two innovative research studies conducted by UNDP Philippines' Accelerator Lab and Pintig Lab to assess the socioeconomic situation of the Philippines in the time of COVID-19. The first research used chatbots and community mobilization for data gathering to reach the vulnerable households, while the second research explored the potential of non-traditional datasets such as fast-moving consumer goods, spending data, and mobility to track the socioeconomic recovery of Philippine households. To formally open this morning's program, we will all hear from the resident representative of the United Nations Development Program in the Philippines, Dr. Selva Ramachandran. Dr. Ramachandran, a Malaysian national, is a seasoned development practitioner. Prior to his appointment at the UNDP Philippines, he served as a UNDP resident representative and country director of UNDP Sudan, UNDP Country Director in Libya, Chief of Northeast Asia and Mekong Division at the Regional Bureau of Asia Pacific in New York, and UNDP Country Director in Yemen. Esteemed guests, allow me to turn over the floor to Dr. Selva Ramachandran. Over to you, Dr. Selva.
Thank you, Cha, for that kind introduction. Good morning to all participants who join us today in this webinar, as Cha mentioned, co-hosted by UNDP, Zero Extreme Poverty Coalition, and the Analytics Association of the Philippines. All protocols are observed. Cha will take the role of introducing all the panelists and guests, so I will not do that in my opening remarks. Today's topic on innovation on data and policy on COVID-19 is timely and is of importance given our current operating environment. As the world marked 18 months of fight against the pandemic, the Philippines continues, like other countries in Southeast Asia, to battle not only a health crisis, but also social and economic crisis. Many countries in the region are now facing an increase in COVID-19 infections. Indeed, policymakers across the region are facing unprecedented challenge of managing a crisis under extremely high uncertainty. Today, we stand at a crossroads. Our policy actions will not only determine the pace of the economic recovery, but also protect the most vulnerable from plunging into poverty. I would like to share a couple of points as we all navigate these difficult times. First, we must ensure that recovery is sustained. The data realized from PSA indicate that the positive growth rate for Philippines was registered in the second quarter. Philippines economic growth rate plunged to negative 9.6% in 2020, and the pandemic impacted all sectors of the economy, thereby affecting large segment of population. In Q2 of 2021, the Philippines GDP has been reported to have grown by 11.8%, a steady growth rate achieved in recent times. However, this was also due to what is termed as a base effect. In fact, the recent estimates from the World Bank reduced annual growth projections for Philippines to 4.7% for 2021 from 6.5% in earlier pandemic projections. Notwithstanding the slower than anticipated growth, the progress in growth 2 is good news as it heralds that the country's economy is on path to recovery. However, the emerging recovery is further threatened by another round of lockdowns in August and as we witness now to counter the rapid spread of the COVID-19 variants, especially the recently detected Delta and P3 variants. It is evident now that managing the pandemic and bringing it to a durable end is an economic imperative to inclusive and sustainable recovery. Second, recovery is increasingly uneven among population groups and geographical areas. Several reports indicate that about 1.5 million to 5 million Filipinos have potentially been added into poor population, reversing gains achieved since 2015. COVID-19 does not discriminate in who it infects, but it disproportionately impacts the poor and the most vulnerable, those who are living on the fringes and who are barely able to keep food on the table. According to UNDP's COVID Pulse Survey Phase 3, which collected data in March 2021, 55% reported that the income has worsened compared to their situation in previous year. Among those who reported to be worse off, 42% reported having difficulty in maintaining a regular income due to COVID-19 restrictions as their main reason. The same survey also covered 6 provinces and 1 highly urbanized city with an effective sample size of close to 18,000 households. Among the households surveyed in these provinces, 75% experienced a decrease in their income, while another 47% lost their job or business during the pandemic. The most vulnerable sectors, especially women, children, and the informal workers were most affected. This implies the need to strengthen social protection systems to ensure that those who need protection are afforded the required support. Lastly, in a prolonged crisis like COVID-19, policymakers need at their disposal high-frequency data, which is not always available. It is evident that government, the public, health, humanitarian, and development workers need to have access to accurately and timely data. We are pleased to share today with you some of our work towards a data-driven policy making in a prolonged crisis setting such as COVID-19. Through UNDP Philippines Accelerator Lab and Pintig Lab, 2 innovative research studies have been conducted to assess the socioeconomic situation of the Philippines in the time of COVID-19, which can inform COVID-19 response and recovery related efforts. The first was done through the COVID Pulse Survey, which used chatbots and community mobilization for data gathering to reach vulnerable households. The second explored the potential of non-traditional data sets, such as fast-moving consumer goods, spending data, and mobility, to track the socioeconomic recovery of Philippines household by geographic area and socioeconomic groups. In addressing the data gap to inform and support the Philippines COVID-19 related policy making, wide range of experts have risen to the challenge. Data scientists, economists, epidemiologists, humanitarians, social scientists, gender experts, mathematicians, and a wide range of local and international policy actors have also worked together. Collectively, we believe that the road to sustainable recovery can be built on the foundation of data-informed policy and decision-making. We are joined today by some of the best in the areas of expertise to share their valuable thoughts. In closing, as the world coped through the challenge of COVID-19, UNDP believes policymakers have to do the hard balancing act of crisis response and recovery. First, they acknowledge that Philippine government's effort to protect the population through financial and in-kind support. It was not an easy task to do. Nonetheless, considering the magnitude of the crisis, more should be done by strengthening and integrating the existing social protection systems into a more robust one. By this, we mean one that may support people's recovery in a more sustained manner. Second, the economic recovery deepens. As the economic recovery deepens, the country may benefit from having a holistic approach that also empowers individual and business to thrive. A strong digital infrastructure needs to be in place, more jobs need to be created, and a healthy business environment needs to be fostered. Third, as we enter the budget season, we need to be mindful that sufficient resources are allocated to continue to manage the pandemic through effective health measures, including strengthening the vaccination drives, while also deepen the recovery efforts. Thank you again for joining us. I look forward to a fruitful discussion, and I hope this webinar will contribute to policy-making direction as well. Thank you.
Thank you so much, Dr. Selva. And as Dr. Ramachandran mentioned, in a crisis like COVID-19, policymakers need at their disposal high-frequency data, which is not always available at their disposal. Truly, the government, the public, health, humanitarian, and development workers need to have access to accurate and timely data for informed decision-making for a sustainable and equitable recovery. Now we would like to let everyone know that this webinar is finally being live streamed on the UNDP Philippines Facebook page. So please feel free to share that link across your networks. It's UNDP Philippines on Facebook. Moving on, with us here as well today to deliver opening remarks is Brother Armin Luistro, to represent the Zero Extreme Poverty Coalition, one of our partners for this initiative. Brother Armin brings with him over 34 years of experience in both the private and public sectors. He served as the Secretary of the Department of Education from June 2010 to 2016, where he led the implementation of the K-12 basic education program. Prior to this, Brother Armin was at the helm of the De La Salle University, serving as its president from April 2004 to June 2010. In previous years, he also served as president of the De La Salle University System and several other La Salle schools. From 2017 to 2019, he returned to his post as the president of the De La Salle Philippines, the network of La Salle schools in the country. It is truly my honor to introduce him today. Welcome, Brother Armin.
Maraming salamat, Char. Magandang umaga po sa inyong lahat. On behalf of the Zero Extreme Poverty Coalition and its secretariat, the Philippine Business for Social Progress, I am very, very pleased to join all of you and greet all our distinguished guests, both government, non-government, and international agencies, but most especially those who work tirelessly to address the world's most urgent problems. And the pandemic is just one of them. Thank you to UNDP and its partner, the Analytics Association of the Philippines, for inviting me to the public launch of the results of this most recent study. That should provide all of us, hopefully, with leading insights on the ongoing pandemic. Well, there are 100 other areas of interest to serious documenters and researchers, but we need to hold the line for the poor and marginalized, as recovery remains elusive for them. We can be lost in the numbers, in data, in various tables, in statistics, but we should never forget the stories from the ground and the cries of those who are poorest. Dear friends, we are aware that the recovery from the pandemic and from recession is uneven and uncertain. I'm not an economist, so I allowed the economists to debate whether in the Philippines, the second quarter of this year marks the end of the recession. But we are also very much aware that much of the numbers are driven by part-time jobs and lower pay work. Despite the much admired resilience of the Filipino, recessions disproportionately affect the poor who have less capability to cope and bounce back. We are definitely more aware at this time that social protection is essential and life-saving, that the scale of ayuda or government support must be commensurate to the size and depth of economic and social pains. That while the short-term fiscal hit of a comprehensive assistance and recovery program is significant, condemning the poor to a bleak present and an insecure future is far costlier. And that the economic crises and the public health crises are so intertwined that we must address them simultaneously, coherently, and continuously. As official daily figures of infections in the country reaches record-breaking numbers by the thousands, it was beyond 22,000 yesterday. The deep deficit in our resources requires a surplus in innovation and compassion. I am personally interested and very, very much pleased to see the Filipino discarte as part of the study. I will allow you to dive deep into that as our researchers share that as part of the leading insights. In the end, we need constant innovation from how we measure the impact of this pandemic, but most especially on the people most affected, as well as on the interventions and support we provide their communities. We have to steel ourselves for a more prolonged and protracted campaign against its worst effects and remain ready with short-term relief measures while working on longer-term recovery efforts. We must continue to look out for each other. Perhaps one of the more important insights that we should never forget. Continue to look out for each other. Those doing the helping will need help and care of their own. Dear friends, beloved colleagues, it is my hope and prayer that the results of this study, leading insights, that will be presented today will contribute to a better knowledge of the actual situation on the ground and allow us to hear the voices of those who continue to be in dire need. Maraming salamat po.
Maraming salamat din po, Brother Armin. Truly, the pandemic has had disproportionate impacts on the most vulnerable. And thank you po for reminding us to look into the stories beyond the data and the numbers and to always have empathy when we analyze the situations on the ground. Our socioeconomic recovery efforts must ensure that we leave no one behind. And as mentioned, today we will have two presentations on the reports from the UNDP's Accelerator Lab and Pintig Lab and their recommendations. Our first presenter is Ms. Yemi Werkey, the Senior Policy Advisor of UNDP Philippines. Ms. Yemi heads the Impact Advisory Team, which is responsible for policy research, partnerships, and pipeline development, and which also houses the Accelerator Lab and Pintig Lab of UNDP Philippines. Here with us today is Ms. Yemi to present how we can leverage non-traditional datasets for assessing socioeconomic impact of COVID-19 across Philippine households. The floor is yours, Yemi.
Very much. Thank you very much, Char. Pleasure to be here today. I'll be making the first presentation from our end, the one focusing on leveraging the non-traditional sources of data. I'm not sure if you could see my slides. Can you see my slides?
No, Yemi, we can see your browser.
Okay, just a moment, please. How about now?
Yes, perfect. I think you should play it as a slideshow. Okay,
Wonderful.
Perfect. Over to you, Yemi.
Thank you very much. It's a pleasure to be here today. I'm going to be making the presentation, sharing the key insights generated from the very first experimental policy research that we've undertaken under the Pintig Lab. And we explored the potential of non-traditional data sets. Now, by way of an outline, I would say that we have a couple of questions that we have explored. The data set that we have utilized, we'll describe that, and then we will also share the key insights as we promised, and finally we'll conclude. So let me now go to the research questions. First and foremost, as I said earlier on, this is an experimental research, and we wanted to explore the potential of non-traditional data sets. That is the primary objective. But by way of a thematic area, we focused it on assessing the impact of COVID-19 and the state of recovery at national level. We wanted to also see if there is any difference in the pace or speed of recovery across households belonging to different socioeconomic groups, and if we also can detect the effect of cash distributions in the data set. And just one second. And then we also explored mobility and restrictions. Now, let me now go to describe the data set we have utilized. We used private sector data for market research, which is not always been used for policymaking purposes. And we focused on the fast-moving consumer good spending by households. You may be wondering what this data set is all about. It actually is in high demand, a type of spending which encompasses packaged foods such as noodles, chips, bread, and it also includes toiletries, beverages, and over-the-counter medicine and personal care products. It encompasses all these, and the spending of the households along the lines of all these has been traced in this data set. The data was collected by a private sector company called Nielsen. It covers 3,600 households, and it is representative enough with 25.5 million population. It covers various geographical areas: North and South Luzon, Greater Manila area, Visayas, and Mindanao. It also covers various other socioeconomic groups. Most importantly, this data is generated on a monthly basis, quarterly, as well as a yearly basis, meaning it is possible to use it as often, and it is high frequency. So now let's move on to analyzing or generating the insights. What did we do in order to analyze the insights? First and foremost, we use the official data from the government of Philippines to establish the status of economic recovery. We selected few indicators. We know there are many. We selected real GDP, total household consumption, again, real one, real food and non-alcoholic beverage, and consumer outlook. These are the few official indicators which are generated on a quarterly basis that we utilized. Now, to read this graph, the blocks that you are seeing here are the hard restrictions that have been put in 2020 and 2021. And the lines represent various indicators I just listed out. So how to read these graphs? The graph is to be read as follows. We took the real value of these indicators and we divided it by 2019 average levels to establish whether any one of these variables have returned back to their pre-pandemic levels. So if the line is above zero, it implies that it recovered and is beyond 2019 pre-pandemic levels. If it stays in at zero, it means it is back already to pre-pandemic level. If it stayed in below zero, it means that it has not yet fully recovered. So if you look at GDP, which is the red one, and blue one, total consumption, you see that they are mirroring each other, which is natural for an economy that is driven by consumption. And for March of 2021, although there is some progress, it's still below zero, indicating full recovery is yet to be achieved. The only variable which is in this food and non-alcoholic beverage is the one that is staying above zero, implying that particular type of variable is above. It's above the pre-pandemic level. I think food and non-alcoholic being essential spending, it is not surprising to see that. The next other variable which I wanted to highlight here is the outlook of consumers. It is still improving. However, lately it's plateauing a little bit, implying that consumer confidence is yet to be back to fully in the pre-pandemic level. And then again, the pace of recovery is also slowing down. So let me now move on to overlaying the non-traditional data indicators, two of them, on top of what we already did. Similar approach is being followed here. And the black line is the consumer spending on fast-moving consumer goods. And a mobility index, which is generated from Google, has also been overlaid here. You will see that the orange line, that is the mobility index, has dipped very much, almost to 80% of the pre-pandemic level when we had a hard the lockdown in 2020. And when we had recently in April again, another lockdown, hard lockdown, it also dipped again, but not at the same level as it was in 2020. Essentially, what is very clear here from the mobility data is mobility is still depressed, although some signs of improvement are being observed. When we look at the fast-moving consumer goods, it is very interesting. The black line, it's fitting very well and mirroring more or less the patterns of that of total consumption and GDP. It is approaching the pre-pandemic level, but not yet crossing that line, implying that some element of recovery signals are observed, but recovery is not yet assured, not fully recovered yet. So it's an important insight that we have generated using this data. Now, let me move on analyzing the same across socioeconomic groups. The Nielsen data, the private sector market data that we've used, divides households into 4 groups using 7 indicators such as housing, neighborhood, education level, and so assets or facilities and so forth. So in that way, they divided households A, B, well-to-do one, highly educated, at least with a graduate degree, and then C, white-collar workers, equally educated, at least with a college degree. And then D is a blue-collar workers who have actually graduated from secondary school or have vocational training. And E is a mix of unskilled and blue-collar workers, which is also one of the most vulnerable groups. So how are these 4 groups faring over time in their pace of household spendings? Here you go, you will see that AB group, all the way through, starting from the second quarter, immediately after the hard lockdown in 2020, stayed in above 0, implying that they have already recovered and stayed sustainably on a recovery path, except recently in July when they dipped. C, similar pattern observed. They stayed in, the white collar workers have stayed in all the way through in 2021, above 0 until recently in July, which is also an indication that they recovered more or less for much of the 2021. D, which is the blue-collar workers and not much educated, are the one who suffered hugely. They remained for much of the pandemic period below 0, implying never ever recovered to their pre-pandemic levels of spending. E, which is an interesting one, actually have an interesting story to tell here. It's spending, the groups in that category has a spike around May 2020 when we are in the middle of the hard lockdown. Clearly might be related to the cash handouts, and they also have somehow a plateau. It's the purple line if you are following me here, some sort of plateauing when we had another lockdown in 2021. Again, might be related to the cash handouts. That's what we believe in. In what we could observe in general from this slide is that the well-to-do group or the richer group has recovered more or less by 2.5% higher on average than the rest of the groups, meaning recovery is uneven. And when we look at these, we should be looking into supporting not only the most vulnerable, but also those who are in the category D. So now let me do the same for the geographical areas. Here you would see similar kind of pattern across regions, households belonging to different regions. The recovery is again uneven across these groups. And what is also very interesting is that Mindanao and Visayas have stayed in or at least have had a sustained back to recovery levels in pre-pandemic levels for much of the time, because maybe it's because they didn't have quite a strong restrictions there, whereas other regions such as North and South Luzon, together with Greater Greater Manila area actually are below their pre-pandemic levels of spending, meaning households residing in these areas are still yet to be fully recovering. Now, let me finally explore the mobility data from Google. Here we are depicting mobility levels by geographical areas. Again, you will see that all regions dipped at the beginning when we had a hard lockdown in 2020 in terms of their mobility, and thereafter some sort of improvement has been witnessed. And Mindanao leading the way in terms of improving mobility, whereas Greater Manila lagging strongly behind, and mobility is very much depressed, more or less 50% from its pre-pandemic levels. And what is also interesting generally in this graph is that almost all regions to date have actually remained below their pre-pandemic level in terms of achieving mobility levels, meaning people are yet to feel confident and safe to move around, to be able to do their work, generate livelihood and income. So it is an important indicator. We've got to really try and work in terms of boosting their confidence and safety. So this is what we've observed from the mobility data. Now, by way of conclusion, let me just say that non-traditional data, such as the market research from private sector, actually has very good potential to provide us some leading insights for policymakers in a much more frequent manner than official statistics. So we must explore them as we move forward, battling a pandemic which is prolonged. And second, we're witnessing some signals of recovery, but that signals are not yet to be strong, and it is very fragile. Third, insights that we have learned is that recovery is uneven across geographical areas and across the socioeconomic groups. And most importantly, we believe that cash handout may have had a role in terms of cushioning the drop in consumption, and must be further explored. Social protection must be strengthened for us, not only to protect the poor, but also to accelerate or deepen socioeconomic recovery together with vaccination and strengthening of the health protocols to control the pandemic, which is very, very important aspect. So these are some of the insights that we have generated, and we are quite delighted to share this with you, and presented this on behalf of the entire Pintig team from the UNDP, and the report is available online. Please read it. I truly invite you to do so, and thank you very much for the opportunity. Back to you, Char.
Thank you so much, Yemi. And again, like just echoing what you've mentioned, based on the data, recovery has been uneven across different socioeconomic groups, and the signs of recovery are very fragile. We still need the support to cascade, and that we need to strengthen social welfare support and our vaccination efforts as well. And as mentioned, that report will be made available to everyone. We will provide the information via a post-activity newsletter after this webinar. And now to present the COVID Pulse PH, a collaborative endeavor of the Zero Extreme Poverty Philippines 2030, a coalition of non-government entities and networks, and the United Nations Development Program in the Philippines, which aim to take a pulse on how the poor in the Philippines have been affected by COVID-19. We have with us Mr. Francis Capi Capistrano, head of experimentations of the UNDP Philippines Accelerator Lab. Through his role, he collaborates with program team members and partners in designing and implementing experiments on frontier development areas such as civic action against poverty, marine litter, and sustainable cities. He also dabbles into data innovation, helping to set up the Pintig Lab. Capi was a journalist who now brings his core skills of asking questions, interrogating assumptions, and telling stories into public sector management, reform and innovation, knowledge management and strategic communication, and monitoring and evaluation. Welcome, Capi, and turning over the floor to you.
Magandang umaga po sa ating lahat. Thank you so much, Char. Let me just quickly try to share my screen. And first of all, thank you everyone for attending this webinar. Yemi earlier talked about the general condition of the economy, and using a representative sample derived from a non-traditional source of insight for policymaking. This time around, I'm gonna zero in on the poor. Probably you can refer to them as the class D and E, but this is the section of society that UNDP is interested in as custodian of SDG1, and also the Zero Extreme Poverty Coalition, whom we've been working with since 2019, is of course keenly interested in. Just to recall, ZEP is a coalition of more than 140 non-government entities that have banded together to try to drive collective impact to zero out extreme poverty by 2030 and meet the other sustainable development goals. UNDP Philippines, particularly the Accelerator Lab, has been collaborating and co-experimenting with ZEP on trying out new ways of working. And under the pandemic, we saw a constraint that gave birth to an opportunity. When the pandemic struck and the hammer fell, the hard lockdowns were imposed. Naturally, the ZEP's member NGOs could not do the usual thing, which is to go on the ground and check on the condition of their beneficiary families or their constituents. We, meanwhile, thought that maybe we can try out and use an ubiquitous tool, social media tool that's being widely used by ordinary citizens and even the poor. That's Facebook Messenger. And we believe that even the poor widely use this since it is accessible through free data. So we thought, why don't we try to test it and scale it as a way to reach across mobility restrictions. I'm sorry for that, and provide a safe space for the poor households for them to give feedback and information on their condition. So we started this in May 2020. We've conducted 2 phases covering Metro Manila and Metro Cebu last year. And now we've gone on to phase 3, which we did in March to April of this year. We tried to test not only if the chatbot tool will work in a wider coverage across the country, covering various contexts, but also we wanted to support in particular this mechanism called local convergences that ZEP is trying to set up as vehicles of as multi-stakeholder partnerships for poverty reduction in the new normal. So we designed this phase 3 of the survey, of the COVID Pulse PH survey, to look at the multidimensional impacts, to sort of set a baseline condition from which to base recovery plans and agendas. We also wanted to kind of cover and try to inventory the capabilities and aspirations of the poor. We ran this in March to April this year, as we mentioned, covering a total of about 18,000 households. This is not a representative survey, but more purposive. We really targeted poor households, particularly through the community organizers deployed by our NGO partners, as seen on the screen. And at this point, we'd like to thank, first of all, the ZEP network and its partners, PRRM, who we also tap for this work, as well as AI4Gov, which is the technology partner that developed the chatbot and deployed it for us. We've covered 6 provinces and 2 metropolitan areas, as you can see repeatedly later. At baseline, we've seen that our household size is around normal. More than half have 4 to 6 household members. Again, since we targeted the poor, the 90% of our respondents earned less than 10,000 a month before the pandemic, with 63% of them earning less than 6,000. And the other interesting bit that's important in our insights would be the high level of informality. It's more than half across the nation. Informal sources of income would include seasonal or casual workers, ambulant vendors, while the formal workers would have permanent jobs, but majority of them are still contractual workers. And while it's just a little over half on average nationwide, there are provinces like, for example, Bohol, Eastern Samar, Sarangani, which have a higher level of informality as compared to, say, Metro Manila, which is where there's a little more, where the employment is largely coming from the formal sector. In Nueva Ecija and Sorsogon, it's a little more balanced. So here you can see, and you can see more details of this in our report, which we are releasing today. We asked our respondents, what happened to you in last year, in 2020, on the onset of the pandemic? And around 3/4 of our respondent households said they experienced a decrease in their income, with nearly half of them losing their jobs or closing their businesses. About 40% experienced hunger, and about 1/3 experienced difficulty in accessing healthcare services. We also asked them, compared to last year, how are you this year? As of March 2021, this year, 6 out of the 10 households, at about 60%, said that their condition has worsened this year compared to last year. This only shows that the condition of the poor has barely recovered, and it kind of corroborates what Yemi has presented earlier with regard to how classes D and E have barely gotten back to pre-pandemic levels of household spending. It's the same, largely the same across the board, across the provinces, with all experiencing decreases of incomes and rates of worsening income in the majorities. Some more than others, like Metro Manila is notable to have a less degree of worsening income in 2021 as compared, say, to Eastern Samar and Sarangani, which is nearly 70%. Same with Nueva Ecija. We're interested, of course, in why the incomes worsen and why, for the minority, why they improved. So for the majority whose income situation worsened, it's really mainly because of the difficulty in maintaining regular income due to the COVID restrictions. And this applies not only to those areas which experienced hard lockdowns or ECQs, but also in the areas which were, in many ways not locked down but locked out of their markets, if we can put it that way. That's also in many ways the reason why about 1/3 of the respondents reported saying that they might have a source of income this year, but their revenue, their earnings from their business, or their ability to work more days is lower this year than in last year. For the minority whose income improved, and this we want to emphasize, it was really government support, with 64% of those whose incomes improved. 64% of them is because they received government support, while more than half said that they were able to get a side hustle, as a sideline, as we would say in Filipino, sideline job or business. Factors for recovery, it's we checked on the factors for recovery across provinces, and they were largely just the same, receiving government support, with number 2 and number 3 changing, whether it's having a sideline work or business, or having informal support from their personal networks, or being back to their previous job. But again, we emphasize here the importance of government social protection. So we've looked at the past, or at least the present, how the pandemic has affected poor families, and we see that they continue to struggle from the disproportionate impacts of the pandemic. And one of the insights that you can see in the report is how informal sector suffered more than those who are in the formal sector. But we are also interested in the future. What does it hold for them? We asked them what are the assets that they have, capabilities and other real assets that they think might be useful for them to survive or thrive in the new normal. And across the country, majorities would report that they have basic business skills. We're not talking about basic accounting or bookkeeping, but it's really the basic ability to sell or find opportunities or find a sideline. 40%, and this applies mainly to the metropolitan or urbanized areas that we surveyed, is because they know how to do online work or business. And then that third, depending on the context, it would be membership in organizations or social capital that's important in urban areas, or having livestock, which is important in rural areas. In terms of coping mechanisms, almost equally reported, having savings for emergency or capital, having friends and family to rely on for help, or government aid or benefits. And And I must note, for example, that savings might be a peculiar finding, but we're not talking about thousands of pesos or 10% of their income, but really 100 pesos, 500 pesos that they can use pampaikot ba to circulate in their for their business. So it's same across the board, but of course you would obviously see that in the more agrarian areas, having livestock is a little more salient. Having tech work skills and online work is a little more salient for Metro Manila, for example. And there will be differences that are interesting, that could be of interest to local policymakers when you look at the municipal level data. Finally, we asked them, what do you aspire for in the new normal? And this is a reverberating reply across the nation. They were reporting that they want good health, enough quality food and basic needs, and quality education for their children. So these are really the three aspirations. In some municipalities, having a peace and secure life comes on top, or having more business opportunities. But largely the aspirations revolve around these three. So I guess that's a big question that we can put on the table. How can we help the poor, as Brother Armin said earlier, na dumiskarte to be able to meet their aspirations? And in terms of opportunity and industry interest, there's a majority who believe that they will thrive, or they prefer to thrive in business in the new normal. They prefer business opportunities than employment opportunities. And it differ, and these are the industries that they're interested in, mostly in wholesale or retail trade or in agriculture. But we would note that, of course, those opportunity interests also change across the provinces. Like, for example, interestingly, in Metro Manila and in Sarangani, for example, more respondents are interested in business opportunities than, say, in Bukidnon and in Sorsogon, where the respondents are more interested in more gainful employment. Interestingly enough, those who are in the agriculture sector, or who want to thrive in the agriculture sector, would prefer employment over business. So there are other micro insights that we believe local policymakers and planners could also, and local development actors could extract. And this is where I go into further analysis that we did through the help of our partners. And this is also reflected both in the policy paper and in the accompanying technical report. We did some clustering analysis where we tried to cluster the respondents according to similar characteristics. First, we did the clustering at the household level based on household characteristics, and we see that the respondents cluster around basically income segments: poor, extremely poor, and those who are better off. I'd let you read through the detail, but maybe I just want to highlight one of the key differences, which is on which kind of capital, for example, they depend on. We see that the better off and the poor, those who are just below and just above the poverty line, so to speak, they rely more on human capital versus the average, and they have a little more access to savings, a safety net. For the better off, a little over the poverty line, they do have other sources of social safety nets, compared to the extremely poor, where they really more rely on personal and government safety nets. And access to market services, you can also see differences here. I also did some clustering based on the individual respondents' characteristics and reported preferences. And there would be differences in the way they are clustered within the provinces, but nationally we try to do this clustering, and there are they would typically cluster around sectoral identification. And the four that comes about at the national level analysis would be women, senior citizens, the youth, and farmers. And you can see here how different their transversal skills or soft skills are, their level of education, and their preferences. So these are important notes to take note of. I guess that's where I transition into my conclusion. And these are key policy insights and implications that we discuss in further detail in the report, which we invite you to read, and also to play with the data dashboard that comes with it. The first really is that while the impact of the pandemic is broad-based, all provinces were affected, and there's a disproportionate impact on the poor in the informal sector. There are variations across localities on how exactly the families were affected and what their preferences are and what their capabilities are. And those require targeted, customized action at the local level. Second, um, to support, I suppose, targeted recovery, we want to emphasize that an important base for sustained recovery would be strengthening health response and containment. So we have to continue investing in this as a society, coupled with increasing social protection to not only to try to help them thrive and cope, but also to try to boost consumer demand, noting that our economy is consumer driven at present. So that those twin objectives of stronger health response and stronger social protection is we believe would provide the base for sustained recovery. Third, and we've emphasized this, we've seen the high level of informality, and we've seen how informality has given them a certain level of a greater precarity, of course, greater risk. And but of course there are also lessons to be learned to be learned from the way they live as the entrepreneurial class, so to speak, and which leads us to emphasize the need to scale up support for MSMEs, particularly micro entrepreneurs, even nano entrepreneurs, and sustainable livelihood. We know that as much as we as a society would want to leverage on the fourth industrial revolution, for example, we have to be conscious that our programs and policy emphasis also do not leave the poor behind. We have to be where they are. We have to support them where they are, where they currently are, and help them transition to a better normal. Finally, and this is very relevant with the impending implementation of the Mandanas ruling in 2020, boosting localized and targeted response requires society to support LGUs to proactively contain the pandemic and provide socioeconomic assistance. And the onus, of course, for this action is on local governments. And by next year, they earn a windfall. We have our friends from DBM here who can tell us by how much. But we're also saying that it's not just local government's role to act, but also civil society, the private sector, all sectors at the locality. And as a final note, we must want to emphasize that the poor, we've found in the study that the poor are not completely helpless. Ika nga ni Brother Armin kanina, may kakayahan silang dumiskarte. Ngayon, it's upon us as a society, as multi-stakeholder, through multi-stakeholder action, to enable them to provide a platform for the poor to build and actualize their capabilities and aspirations and create a better normal for the Philippines. Thank you and good morning.
Thank you so much, Cappy. And again, very, very insightful and interesting recommendations as well. I'm pretty sure our panel members would be able to build on to the recommendations that you discussed for the panel discussion as well. But just to echo that first recommendation, targeted response and support for the poor to enable them to achieve their aspirations. Your second recommendation is to strengthen our health response, followed by support to MSMEs as well, and support to LGUs so that they can have stronger recovery programs in time for the Mandanas. And now we have come to the part of the program I believe that is quite interesting for everyone. Before anything else, I would like to remind everyone that the COVID Pulse PH summary report and the technical report will be made publicly available today along with the presentations. We will include them in the post-event newsletter that we will circulate, and instructions on how you can how you can get an e-certificate as well will be included in that newsletter. And for those who might have questions on the presentations given, please feel free to put them down in the Q&A box here on Zoom and on the comment section of our live stream on UNDP Philippines Facebook page. Now to discuss lessons from the Philippines' socioeconomic recovery and to expound on some key findings from the reports, we have invited esteemed speakers from different sectors for a panel discussion, which will be moderated by our very own Dominic Ligot, lead scientist of UNDP's Pintig Lab. His current work focuses on human rights, public health, food security, political risk, and fighting disinformation infodemics through the use of computational social science, social listening, remote sensing, artificial intelligence, and data engineering. Dominic founded Zeralytics, a social impact data analytics company, and co-founded Data Ethics Philippines, an online community focused on social issues such as data privacy, data security, AI-driven discrimination, data liabilities, data ownership rights, and data poverty. Doc also co-founded the Analytics Association of the Philippines and is a board of trustee member of the Philippine Center for Investigative Journalism as well. Welcome, Doc Ligot.
Thanks, Char. Good morning to everyone.
Good morning, Doc Ligot. We are also fortunate to have with us 5 panelists from various agencies and sectors to share with us their perspectives and insights on the reports that were just discussed previously. Allow me to introduce them to you one by one. Our first panelist is Undersecretary Rolando U. Toledo. He is presently the officer in charge Undersecretary of the Department of the Budget Policy and Strategy Group of the Philippine Department of Budget and Management, or DBM. He directly oversees the operations of the Budget Information and Training Service and the Fiscal Planning and Reforms Bureau and its conduct of fiscal policy research and planning, development of fiscal and budgeting frameworks, formulation of the annual and quarterly whole of government allotment and cash release programs, and monitoring of macroeconomic developments and their impacts on the budget. Let's all give a warm welcome to Undersecretary Toledo. Welcome, Yusek.
Thank you, Char. Good morning to everyone.
Good morning, sir. Our second panelist is no other than Dr. Kelly Bird, who is currently the ADB Country Director for the Philippines. Prior to his assignment, he was Director of the Public Management, Financial Sector, and Trade Division in the Southeast Asia Department of the Asian Development Bank. Prior to joining the ADB in 2006, he worked as part of a USAID-funded project with the Indonesian government from 1999 to 2005, and in 2006 as a consultant on trade policy with the World Bank in Jakarta. He graduated with a PhD in economics from the Australian National University in 1999. He has published several papers in international journals as well. Let us all welcome Dr. Kelly Bird. Welcome, Dr. Bird, and thank you for joining us as well. Our third panelist is Dr. Aniceto Orbeta. He is the president of the Philippines Institute for Development Studies. His research interests include education, labor market, impact evaluation, applied economic modeling, and information and communication technologies. He did postdoctoral studies at Harvard University and has a PhD in economics at the School of Economics, University of the Philippines. He served as a consultant to multilateral institutions and as principal investigator for the Innovations for Poverty Action. Good afternoon, Dr. Orbeta, and welcome.
Afternoon. Morning.
Sorry, good morning. Good morning po pala. Our next panelist is Ms. Maria Rosario Felisco. Ms. Lot has extensive experience in humanitarian and development programs, having worked with different NGOs in the Philippines and East Asia. She is currently the country director of Oxfam Philippines and has held various senior posts in Oxfam, including a posting in Hong Kong and Beijing as the policy director of Oxfam Hong Kong. She also served on the faculty of the College of Social Work and Community Development of UP Diliman and holds a master's degree in Social Anthropology of Development from the University of London and a bachelor's degree in Community Development in UP Diliman as well. Thank you for joining us, Ms. Lot.
Gandang umaga, Char. Salamat.
Gandang umaga po. Our last panelist is Ms. Cynthia Lagasca. She is currently the Division Chief of the Research and Evaluation Division of the Policy Development and Planning Bureau of the Department of Social Welfare and Development. She holds a degree in Masters of Arts in Economics from the University of Santo Tomas. As a planning officer, she has risen from the ranks of a technical staff to supervising different divisions under the Policy Development and Planning Bureau of the DSWD, including as Division Chief, the Planning and Monitoring Division, and the Policy and Research Division. Let's all give a warm welcome to Ms. Cynthia Lagasca. All right, before I turn it over to Doc Ligot to get the panel discussion started, I would like to again remind everyone that we have to use the Zoom Q&A section to submit your questions to the panelists. We will have an opportunity to ask them during the Q&A portion, which will take place right after the panel discussion. Thank you so much, everyone, for your cooperation. And over to you, Doc Ligot.
Thanks, Char, and looking forward to our distinguished panel. So before we get into the discussion, I just want to preface our conversation with a few thoughts. And this is coming from a data practitioner first. The COVID-19 pandemic is the laboratory no one asked for. No? So the data we're getting today is unprecedented. And I'm sure it will likely revise health and economic policy for decades, even after we've gotten out of the pandemic. The problem we have is we have to fix the boat while we diagnose the leaks. And that's always, it's always a work in progress. If you talk about health, the public sees the health data every day. They see cases, deaths on the one hand, and recoveries and vaccinations on the other. But the public doesn't only face health concerns. There are also concerns like jobs, prices, even transportation. These are longer-term pains that we face. And underneath this, and I want to highlight this, are unseen problems, such as mental health and human rights. In fact, according to the PSA report, suicides were up in 2020 and is now the leading cause of death. So this is just another gloomy data point of how much our society is coping during this stressful time. So I want to preface this by saying we seem to have been boxed into a false dichotomy, that of health versus the economy. So the most obvious phenomena here is the community quarantines, which we need to stem the rapid surge in cases. But the obvious is local businesses die during the lockdowns. So this is the backdrop that we are having this conversation, and hope that doesn't start it on too much of a negative note. So first, I'll turn it over to the panel. Maybe first kay Yusek Rolly. Any reactions, sir, from the first two presentations from your perspective?
Okay, thank you. Excuse me. Yeah, thank you, Dr. Ligot. Yeah, this study is presented by, of course, Ms. Wartke and, of course, our friend, Capi, Mr. Capistrano, are both highly commendable, especially as these are able to utilize the non-traditional pathways to provide us another angle into assessing the impact of COVID-19 pandemic across the different socioeconomic groups in various geographical areas of the country. And I find the level of mobility as particular relevant indicator in this study, as well as the disaggregation of the population into different income classes. We were able to really get the more granular insight into how the pandemic prompted mobility restrictions and in turn affected the people's, of course, spending behavior. So that's one. Again, staying on the same note, one striking observation that was presented is the impact of the pandemic on the household spending of lower income families. So really, this study showed us that after the biggest lockdown in April and May last year, the Group D households have lower spending history than the Group E household. Possibly that is due to the distribution of the cash aid or the SAP or social amelioration program, which enabled the families of Group E to have more discretionary income. Now, on the results of the zero extreme poverty, UND COVID Pulse PH Phase 3, meanwhile, tells us that poor households are significantly most affected by, of course, disruption in their livelihood and income sources. This calls for stronger measures to support programs for the job creation or training. And well, I acknowledge that the policy implication highlighted, I think the study of the copy, especially as the UNDP able to align this with the strategies under our updated Philippine Development Plan. So for the part of the DBM, our main contribution is packaging the national budget to operationalize the updated PDP and set us back on track to a sustainable socio-economic recovery. As a matter of fact, we have issued the budget priorities framework, which annually to guide the preparation of the national budget. And of course, that is strongly anchored on the PDP and even to our socio-economic report being prepared by NEDA. So that's what the, as far as when we submit the budget to Congress, provided significant support to our relevant COVID-19 response measure, lalo na itong so for the 2022 budget. I don't know if I have to identify those programs and projects, but you know, as you go on, you know for a fact that we've already submitted the budgets, and you know also what is in that proposed budget. So overall, the results of the two studies supplement or even consistent with the national government's outlook for the country's recovery for the medium term. So of course, from our end, we shall continue to manage the risk brought about by the pandemic while allowing a vast number of people to earn a living. As a matter of fact, you should know that there's a great debate in the IETF as to the between the economic group and the health sector group as to implementation of this quarantine. So the continuous implementation of the vaccination program will especially be a crucial catalyst to support the economic recovery, which we project to grow by 4 to 5% next year. Thank you.
Thanks, Yusek Rolly. I'll come back to you on the budget now for more details, but let's hear from the others first. Can I pass the ball to Dr. Kelly Bird? Any reaction to the presentations from your perspective?
Thanks very much, Dominic. I think both presentations were excellent and very informative. So I enjoyed listening to the presenters. Given time constraints, I'll just talk about the first presentation by Yemi on using mobility data or combining mobility data from Google and Nelson's data, where you can disaggregate across the socioeconomic groups. I think some of the points that resonated with me were that the mobility data is a good leading indicator of how the economy is recovering. It also tells us at this point in time, you know, the restrictions on mobility obviously is limiting that recovery. It highlights that opening the economy safely will be important for recovery. What was also interesting is the looking at the over-the-counter fast food purchases as an indicator of recovery or as an indicator of at least well-being for Filipinos during the lockdowns. What I find from that is that it showed that I guess the first point is a caveat. You know, fast food over-the-counter items is generally neutral to economic recessions. And that's probably why you find that overall, it's kind of fluctuates very closely to its baseline. But what's interesting is when you break that up into the different social economic groups, and particularly during the lockdowns, and there from those results, it showed those that were in group E had a spike in their consumption of those over-the-counter fast foods, whereas group D may have not. What that tells me is that the government's social assistance programs, cash transfers, but also the local government's food deliveries and including ADB's food delivery program in May of last year, were very helpful in mitigating the worst effects of those lockdowns. So that tells me there was a success story in the government programs. A little bit more complicated with Group D, because the Group D are not the poorest, but they're also most likely not workers who receive the wage subsidy. So it's kind of a group that probably needs to have, programs need a better focus or targeting that particular group, the D group, because they don't fall into the 4 Ps perhaps, but they don't also fall into the wage workers. So maybe that's one of the lessons going forward, is ensuring that programs do target that group D. I think I will leave my comments there. Thank you very much.
Thanks, Dr. Bird. I think your last point about whether we're capturing vulnerable groups is a great segue to, maybe I'll pass the ball now to Ms. Cynthia. From your perspective in DSWD, how do you find the findings of the 2 studies?
Hello, good morning. Thank you, Dominic. Sir Dominic, allow me to greet first our members here. Of course, I would like to thank the UNDP for inviting the SWD as a panelist in this webinar session. And I'd like to greet Dr. Ramachandran of UNDP Philippines, Brother Armin Listro, our presenters, Yemi and Sir Kapi, and fellow panelists, participants, and organizers of this event. So good morning to everybody. So the statements and findings from the 2 policy research briefs or presentations that I noted, I would like to quote it, that non-traditional data sets include fast-moving consumer goods spending, that consumption of food, among others, showed a slight increase during the strict lockdowns, and that government's assistance is just a temporary help. Those are quote unquote from the policy studies or briefs. So the use of non-traditional data sets such as fast-moving consumer goods spending to assess the socioeconomic situation of household is very much welcome. So it is the monitoring the trends in consumption expenditure patterns of household amidst the pandemic are important information both for the private, the business sector, as much as the government for its policy and decision making. So it speaks of food, essential needs, food consumption, accessibility to food and market, consumption, coping strategies, even access to health. And this could be good indicators or potential indicators for assessing the vulnerabilities of our the most disadvantaged. So this study also indicated that consumption of food, among others, showed a slight increase during this strict lockdown. So the study findings that those who were able to improve their income cited the receipt of government support. It was 64%, and it cited that government support was the most cited reason for recovery, so across the provinces. So these are good indicators, and allow me to share similar findings from the study of DSWD and the UN World Food Program. This is a joint study at the height of the quarantine last year, and this is titled "The Study on the Impact of the COVID-19 Pandemic and the Implementation of the SAP." So the findings are that majority of the households indicated that they received some form of assistance, so in response to pandemic. And another is that 98% of them used the money primarily to buy food. So these are similar indicators, but let us acknowledge the fact that the government has its legal and moral obligation to serve its constituent. It has given the assistance it can provide for the Filipino people during the pandemic, and we always would like to anchor it on the updated Philippine Development Plan, because this is our anchor that all government agencies refocus its efforts in pursuit of a healthy and resilient Philippines. So though we experience difficulties in providing assistance at the time of the pandemic, the government adjusted its program modalities to ensure the continuity of services. So that stopgap mechanism we call the social amelioration program, they are implemented as a means to facilitate the provision of needs of Filipinos and to mitigate risk. But while the nature of these services, it contributed to address the impacts of the pandemic, but at the same time, like for DSWD, it continues to provide social welfare services, recognizing the disadvantaged are the most affected in this crisis. So it is not just a matter of whether or not the assistance from government is enough to sustain the needs. There is a need, as the two studies have stated, that to ensure the bridging of the gaps experienced by the poor, the disadvantaged, especially on finding a sustainable means of living or livelihood for the family. So there are steps that are being undertaken to amplify the resiliency of the Filipinos, uplifting their quality of life, and it is a prime concern of the government, which we should persistently address, but it would require a whole of government and whole of nation approach. So that is my response relative to the two policy research briefs.
Thank you, Ma'am Cynthia. We'll come back to some of your insights later, no, when we drill down on the SAP. Can I turn it over now to Ms. Lot? No? Oxfam would probably be closer to the ground, no, in terms of seeing what the impacts of the pandemic are. Any reactions to the two policy briefs?
Yes, thank you. I think both policy briefs and both sets of data are very valuable for perhaps different reasons. The FMCG and mobility data as non-traditional sets of data are very valuable because they're high frequency, they're available over a regular, they're very regular and available over time. So they are able to provide quick, timely, current insights that are important for policymaking. The data presented in the pulse research, I think they're very important because they are data coming from people on the ground, and they were captured directly from the people themselves. And moreover, they were captured at a scale that I think is really important for policymaking as well. In the interest of time, I'll just focus on what is really what we consider in Oxfam as important, having a focus on poverty and inequality. And I think what's really powerful is that taken together, the two reports affirm what we have already seen, what we know intuitively, but the two reports provide very strong empirical evidence about the disproportionate impacts of the pandemic on the poor. And this we see from what's been spoken about in the reports about income losses being felt deeper among people who were already poor to begin with. So groups D and E, seasonal contractual workers among those who earned already the least, and also among women who earned less. We see the presence of what can be negative coping mechanisms, noting that savings rate, and I think this might be a more optimistic figure actually if we look at other data sets, but savings rate is not even a third, it's 28%. And contrast that with the access to street lenders, which is at 38%. So that's a very strong, potentially negative coping mechanism. So all of this taken together, while we do celebrate the discarte, the grit and the social solidarity that enables people to survive, I think we must also move to take a more critical approach towards this notion of resilience. Because once we have that more critical approach to this notion of resilience, we are able to move on to putting the onus on what policy should be in place so that these vulnerable people who are continuously at risk will have better chances, not just to survive, but as they constantly say, to thrive. I like very much how the Pulse report used precarity as the adjective to describe the situation of the poor. I really think it is that precarity, the persistent uncertainty in their lives, that policy should address. I think I'll stop there.
Yeah, it's a very dense topic, no, Ms. Lot, and lots of things to unpack. But sige, in the interest of time, I'll pass it first to Dr. Babes Orbeta. By the way, congratulations on your recent appointment, sir, as president of PIDS. Reactions to the two policy notes?
Thank you, Dominic. I think the as data analyst, I am fascinated with the way which the group was able to assemble. As I have to copy earlier, that the national policymakers were using just the Google Mobility because that's one that's available to be leading indicators of the economy. And this one is an addition to that set, and that will enrich the kind of understanding that government officials will have on the nature of the impacts of policies and the pandemics as well. I'm very much like the idea of the fast-moving consumer goods, using that if that's available. And then although Dr. Bird has already mentioned that maybe that doesn't respond too much, there was a mention about consumer aspiration. I don't know why it was not pursued in the analysis, and how to use those data in a much more disaggregated form is really very important for policymakers. But the nice things I observed from the result that of Copy's presentation was really on like things like emerging personas, like because that gives you idea of how certain sets of people respond and how they respond differently, because that could provide insights to policymakers on how to respond better. So that's basically that's a very interesting analysis that maybe that should be pursued, and the aspiration part as well. I was a little bit thrown that back by the result that good livelihood is the number one aspiration, and perhaps because people lost livelihood at this time. So maybe this crisis is such that almost everybody lost their livelihood. So that's why is it that food and basic need did not, of course that's not too far, but usually in times of crisis, that's the basic need will come out first. But now it's good food, good livelihood that they're looking for, essentially. So that's an interesting result, that this kind of on the ground analysis, and very imaginative. I would say that using means with which people have been using, and getting data from them on a much more frequent way is very interesting. And I congratulate the team for thinking of that way of getting responses from the people. And I think that's a very important. I would my last comment would really, I enjoyed previewing the dashboard of the project, and I would hope that this data can be merged with others so that it can be and like providing APIs to the data set so that people can use it in another set of analysis. We will not know how people will use it, but there are other data sets that can be merged, make the the results much more richer in terms of, because you can merge it with other data sets already available. I think that's, I would stop there for this one. Thank you. Thank you, Dominic.
Thanks, Dr. Babes. Yeah, certainly UNDP will be more than happy to collaborate and provide access to that data. So we'll maybe park that offline. No? I think nowadays data is really important, in driving decisions. Sige, maybe let's bring it a little closer to specific points. I'll go back to you, Sec, Rolly. Let's not debate the budget. I think that's already been done in other fora. Maybe I want address maybe a perpendicular phenomena, which is alongside the 2022 budget, we also have the Mandanas ruling. So do you have any thoughts about how ready the LGUs are to absorb the budget effectively to get us into recovery?
Yeah, thank you. Yeah, the national government has been working hand in hand with our local government units together with our Department of Interior and Local Government in the preparation on the implementation of the Mandanas ruling next year. In fact, following the issuance of Executive Order number 138 and its in IRR, we have convened the Committee on Devolution, which comprises a key national government agencies and of course, including the local government units leagues. Okay. Under that EO, the NGAs and local government units are directed to prepare their devolution transition plans to ensure the smooth implementation of the devolution functions, basic services and facilities of the LGUs. So we also be extending capacity building activities to the LGUs to push their capacities for the efficient delivery of public services, including most especially response measures to COVID-19 pandemic. So that's how we are in right now. So we have to make it the transition, or rather the implementation of the Mandanas should be smooth. Thank you.
Thank you, sir. I think that's really crucial, to ensure the recovery trickles down very efficiently. Obviously, it's a work in progress now. Over to Dr. Bird. Since you have a view of other countries as well, do you have any perspective on how the Philippine stimulus compares to other Asian countries? Any ADB perspective on this, and any bottlenecks that you see that you might want to highlight as we go through the kind of the next phase for our COVID recovery?
Okay, let me just first of all mention that back in April, ADB forecasted growth this year at 4.5%, kind of like a floor, 5.5% next year, and we expect recovery to pre-COVID levels of GDP sometime in later 2023. So it's going to be a long road for recovery. But the recovery is in place. Q2 economic growth at 11.8% on year-on-year basis is a very promising result. What it tells us is that about 70% of GDP that was destroyed in the second quarter of last year has recovered. It's not 100%, but it's 70%, and that's sizable. So the recovery is in place, but it's still a little fragile. What is clearly what is going to remain important is how the virus behaves in the community, and we know with Delta, the Delta variant is spreading in the community. So key is going to be, it's a top priority. Key is going to be the vaccination program, and the government has secured vaccinations. They are being delivered in bulk numbers. And I understand, the data shows that close to 50% of the adult population in NCR has had their first dose. And so it looks like, at least 70% of the adult population in NCR will be fully vaccinated by the end of the year. And that's important to achieve those numbers, but progress is very good. In terms of government's fiscal response, last year, in their first fiscal response, we estimated that would have somewhere between a multiplier effect on GDP of between 3 and 4% of GDP. So it was quite sizable. I think their fiscal response has been appropriate. they recognize it's been prudent, and they recognize that you don't want to spend everything in your first year of a crisis. You do need to smooth that out, 2020, 2021, and 2022. And that's what they're doing. And I think that's a very prudent approach. Debt levels for national government debt levels are around 60%. But if you look at Philippines, its peers, middle income countries that have a BBB plus credit rating, that level is a little bit lower, it's at the lower end. So that still means that the government has, relative to its peers, fiscal space. So I think they've taken an appropriate approach to their fiscal response. And it's been targeted in the sense that initially it was targeted on providing social assistance to the vulnerable through the emergency cash grants, also the wage subsidy. And we could see from that data that was presented earlier that certainly has helped, particularly the E group and the C group. So it's been well targeted and at the same time, the government's spending on infrastructure and public infrastructure, and that probably distinguishes the Philippines from most other countries in the region, in the sense that it has the Build infrastructure program, and it's spending on that, and that's going to help stimulate the economy, short, medium, and long term. So that's also has been an appropriate use of fiscal funding, and of course on the health sector, significant funds have been allocated to the health sector. So I do believe it's been appropriately set.
Thanks, Dr. Bird. And it's also encouraging to hear that there is room compared to peers in terms of fiscal response and debt levels. I mean, a lot of people are getting worried about the massive debt the government is building up, but that's to be expected during a crisis. I think the question is how you deploy the funds during that period. Okay, so from a very macro view, I want to dive into something very micro. Ms. Lot, I think one aspect that sometimes evades attention is kind of the effects of the pandemic on vulnerable sectors, particularly from a gender perspective. So any thoughts on this? Does Oxfam have a perspective on how women are coping and how this has affected them?
Actually, there's already a really solid body of evidence globally that women are also disproportionately affected by disasters, and we can consider, of course, the pandemic as an example. And it's said in this body of evidence that if it's not the disaster that kills women, it's the secondary impacts that do. And the secondary impacts can be prevented if our responses incorporate a gender lens. And what sort of gaps in responses can come about if we don't have this gender lens? There's really already very, very strong studies that show that we can basically summarize it around three very important areas that need a very strong gender perspective. One is about women's health and women's bodies. Second is around gender-based violence or violence against women and children. And the third is around the issue of care work. And I'll just go through this very swiftly, but I'll be drawing also on the results of two researches that Oxfam had undertaken. One, the rapid gender assessment done in 2020, which we organized with other UN agencies, local NGOs, and so on. And also the National Household Care Survey, which we did earlier this year in cooperation with the Philippine Commission on Women. So to start with, the first one, which I mentioned, is around women's health and women's bodies. And I'll just zero in on reproductive health. Based on the results of our researches, we saw that in the 6 months of the research, which was already well into the pandemic, only 18% of women accessed family planning services. And this dropped to as low as 4% in some areas. And only about 20% had regular access to services. So this is very critical. And in fact, well, it's good that the Department of Health issued a memorandum that said that reproductive health services should be taken as part of the, there should be continuity during the pandemic response. So that's the first, where we need to have a strong gender lens so that we appreciate that particular area of need. Second is on gender-based violence, and based on our researches, respondents, 25% of them cited a lack of access to reporting incidents of violence and to being able to access support services. And a very large proportion, 19%, actually feared physical violence, especially during the lockdowns. A lot of the respondents said they would go to their local governments, specifically their barangays, to report or to seek support services. So here it's very important to spotlight the role of the barangays in providing this even during a pandemic, making sure that those services are sustained. Lastly, in the issue of care work, half of the respondents said that the time they had spent, the intensity of their care work had increased. And if we look at this care work burden, it's disproportionately borne by women. Women put in, for primary care work, 6.5 hours every day. If you include supervision of dependents and so on, it goes up to 13 hours. Contrast that with 8 hours put in by men. And you might think, well, why is that such an important issue? It's very important because it ties up to women's ability to undertake other roles, to go about livelihood activities, also their health and well-being. And if you think about it, if this takes up so much time of a woman's daily life, then this is something that needs to be supported, needs to be acknowledged, and needs to be made more efficient and more in favor of a woman's health and her long-term well-being. So those are the three areas of gender needs that I would focus on.
Thanks, Ms. Lot. Actually, maybe the statistic everyone can relate to, we talk about build, build, build. Most people doing the building are men. And we talk about health, as you mentioned, most people doing the care work are women. So the gender lens is something that we see every day, but it's hardly highlighted. So it's good that you mentioned this. Talking about recovery across multiple sectors, balik tayo kay Ma'am Cynthia, no? You mentioned earlier about the 4 Ps and the SAP. Any perspective on how we can further improve the social protection packages, no? Particularly in a prolonged crisis? Is there anything we are going to do better or change over the next few months going into 2022?
Thank you, Sir Dominic. Well, the COVID-19 pandemic is a situation that entails both socioeconomic and health-related responses and recovery mechanisms. So I'd like to emphasize again that the directions for the remaining 2 years of the Philippine Development Plan 2020 to 2022 are focused on recovery and resilience. So the updated PDP contains programs that are designed to build resilience of individuals, families, business, government, and society under the new normal. So these are health system improvement, food security and resilience, learning opportunity, digital transformation, and regional development. So there is a Philippine government, the Philippine government created a task force, a national task force, COVID-19, which includes recovery, response and recovery clusters. So this is headed by DOH and NEDA. So respectively, and then they ensure the contribution of government agencies to the necessary measures to be implemented in view of the pandemic. So the recovery cluster has more than 50 agencies that have committed their respective programs and projects for short and long-term recovery. So so that we ensure that the continuity of the provision of services and the observance of all stakeholders to the PDITRB. So what is PDITRB? Prevent, detect, isolate, treat, reintegrate, vaccinate strategy. So considering the structure is already in place, the need to further strengthen the convergence efforts of these member agencies across all clusters employs the whole of nation and whole of government approaches. So this can ensure that no one is left behind in this adversity. And now I'd like to highlight on social protection. In the Philippine Development Plan, there are strategies under the social protection sector. So it aims to ensure access to nutritious food even during emergencies, enable people to manage individual, economic, natural, and human-induced disasters, governance, and political risks. So we all would like to advocate that social protection should be at the core of government policy, pandemic or not. It has always been what the DSWD has advocated, and the member agencies. Actually, there is the DSWD chairs the subcommittee on social protection, and there's an interagency mechanism. There is an SP plan, and I would like to highlight that there is an enhanced social protection framework, that operational framework that initiates the convergence of government efforts. So these are all addressed to empower, to build resilience of the Filipinos and reduce poverty and vulnerabilities. Well, aside from that, there is the formulation of the National Employment Recovery Strategy 2022 that will accelerate employment recovery. So these are geared to restart the economic activities, the restoration of business and consumer confidence. There are efforts also for employment opportunities, employability of workers, and efforts in institutionalizing the social protection floor. So these are all being conducted. And now focusing on the department, the DSWD, there are strategic priorities that it has set forth, what we call the DSWD Sulong Recovery Plan 2021 to 2022. So I would just highlight some of the strategies, the relevant ones, because these are targeted to enhance the delivery of social protection measures so that no one is left behind, especially during the prolonged crisis. So one strategy is to mitigate the socioeconomic impact of COVID-19 and other natural disaster and human-induced hazards, and alleviate the situation of the DSWD clientele. So I will just mention some of the innovative modalities and special interventions under this, such as the assistance to individual in crisis situation. We continue to operate the centers and residential care facilities. We build resilient communities under the program of reducing vulnerabilities of children from hunger and malnutrition in ARM. So the most poor region in ARM, which we call the Bangsamoro Umpungan sa Nutrisyon. We have
Cynthia, I think we're just about out of time. Maybe you can conclude with your final takeaways. Mix na natin with your points, and then I'll pass it on to the others.
Okay, so to highlight, so we would like just to emphasize that there should be more efforts on social protection and improvement of delivery mechanisms. So I'd like to highlight the importance of enhancing social protection delivery through digital transformation. We are going through that efficient government to person payment mechanism, and also because data is important, we would like that the implementation of the PhilSys and its synchronization with the listahanan. So the listahanan is the program of the department to identify the poor and where they are. So these are important, and also relative to Mandanas, we would like to increase the capacity of our local social welfare services, the frontliners, and as a department, we would like to improve our organizational processes, like being compliant to the ease of doing business and streamlining the process. So those are efforts that we would like to emphasize to ensure an integrated social protection system for the poor, vulnerable, and the disadvantaged.
Thanks, Ma'am Cynthia. I mean, those are really solid responses, and hopefully with the cooperation of national local government, we can implement it. No? Dr. Babes, mix na lang, no? Last takeaways, and specifically, you wanted also to highlight the use of data, no? So anything you want to leave the audience today from the webinar? Sorry, I think you're on mute lang.
I think one of the major lessons we had with SAP distribution is how easy it was to deliver to 4 million households SAP within the week it was given. Why? Because we have an existing payment system in the Pantawid, which is mostly. So that gives you the idea that when you want large-scale transfers, the infrastructure is very much important. That's why I think Cynthia has already mentioned earlier that the ID system and now that they tag with that the basic, we were pushing that there should be basic banking accounts with the ID system, so that people who are identified and beneficiaries can easily get their money once in a crisis. Speed is very much important, and that what we have learned from the SAP distribution, and we have a little survey about with purpose beneficiaries, and they were saying they were the PT, those who are not Pantawid, because even if they are not legal, they cannot get because the names are not listed, they don't have accounts and all of that, and that's basically that experience gives you the idea of how important is the payment mechanism in any delivery. So that's also segue to the idea of the importance of data and that we should develop, for instance. And I think the project has mentioned that in a crisis we need as much information as we want. I don't want it yesterday. So I think device generated data are very important, and if we can just use that for policy, that's very, like, for example, in many countries, even the volumes of SMS messages are being used in terms of trying to determine what's the activity of people and how and just the volume, and what's more, if you get the messages and you're able to process that. And so that kind of information, as been already demonstrated by the project, are very important in enriching how we respond. Sometimes we know already the basic things, but how to respond in different ways for different people. That's why I've emphasized about the emerging personas, because that gives you an idea of how to respond to certain sets of people. That's data is telling you. That data can tell you certain sets is what is required by specific sets of people because of their circumstances. And I think only a frequent and high frequency data can give you that kind of feedback. And I hope that we can develop these infrastructures like this to give us high frequency feedbacks in any time, or most importantly during a crisis. I think that's my and the project has shown that. Thank you.
Thanks a lot, Doc Babes. Closing thoughts, Dr. Bird first.
Just one point, and I think it's drawn on what Lot had said earlier. You know, the hidden costs and risks to the pandemic is, the impact or the elevated impact that it may have on domestic violence and particularly maltreatment of children. And I think a lot more research on this will happen over the next 12 months, but that's also an area that's going to be important because it does have long-term effects on the children that are impacted by this. And this is particularly important because the COVID has created those kind of conditions for child maltreatment. The other point I'd like to mention is that, one of the concerns we have is the pandemic has that long-lasting impact, potentially a long-lasting impact on the labor market with elevated unemployment rates. And there it's important for continuing to develop innovative ways to deliver workplace skills and labor market programs. I'll leave it there. Thank you.
Thanks, Dr. Bird. Yusek Rolly, any closing thoughts? I'm sure marami, pero there's one thing you want to share with the audience.
Thank you very much. Yeah, actually, we take note of those key insights and policy implications that was enumerated, and we take note of all of those ones. And I think that is also consistent with the policy of the government. At the same time, we are moving forward. But this is what I can say, despite the limited fiscal space of what we have as a country, at least we have creatively identified program, or rather fund source that we could provide in response to COVID. Now, in particular, for fiscal year 2022, we have, of course, packages strategically to respond for COVID-19 pandemic. And we have actually identified in that budget around 395 worth of programs and projects that are directly responsive to the pandemic, which include a hefty allocation for the health, agriculture, and of course, education and employment sector. So from our end, we ensure that the social programs to be supported next year will continue to improve the widened access to health, education, what else? Social protection services, of course, as well as to reduce the vulnerability of the poor and marginalized. So that's what I can say. Thank you very much.
Thank you, Sik Rolly. Ms. Lot, on your end, any parting thoughts?
Well, I'm really happy that Yusek Roddy and Ma'am Cynthia are here because, of course, budget and DSWD are two of the really critical departments going forward to make sure that not just the policy is in place, but the resourcing would also be there. So thank you also I'm really happy to hear your responses. And for UNDP, this is a great initiative. If there would be others coming after some of the things that I just made a note of, would be more interest in tracking education figures, considering that this is one very important dimension also of poverty and capacity. Maybe you can think about education too, and maybe for the pulse, if there's to be another round of it, also think about how to better disaggregate the data within the sectors that you have studied, because now women is taken as one sector in itself, but I suppose that disaggregation has to happen also within the different sectors. Thank you for soliciting our views on this.
Thanks, Ms. Lot. I want to thank every member of the panel. I think there might still be one more round of questions at Char's level, but as for me, we mentioned before, we're not facing just a health crisis, but an economic crisis, a social crisis. And in these kinds of crises, the devil is always in the detail. And I thank the panel for fleshing out a lot of this detail. My only parting thought is maybe a quote from William Arthur Ward: "Pessimists complain about the wind, optimists expect it to change, but it's the realists that adjust the sails." And I think we've got a panel of realists today, and hopefully, it helps influence the thinking across the audience. So over to you, Char, for I don't know if you're going to do Q&A or the next part of the program.
Hi, yes, thank you so much, Doc Ligot. We will now proceed to our question and answer portion. So we only have time for 2 questions, actually. We apologize that we are not able to take all of the questions that were submitted by the audience, but I think most of them have been answered in the Q&A box as well. So we have 2 final questions, and we will give, this is on voluntary basis, so any of our panelists can take them, but we hope you can, and we will give you each 30 seconds to answer the question. So for the first question, what measures are put in place from the national level to the LGUs to ensure that recovery programs, especially the budget, will not be used for politics, especially since we are having the national elections next year? So I think this question is for Yusek Rolly from DBM.
Thank you, Chair. Okay. We are aware that the next year will be an election year, and it's a timing really that the implementation of the Montana's ruling will be implemented also in that same year. But of course, this is all the budgets and programs has actually designed and at the same time evaluated as far as the national government budget is concerned, and it will be implemented according what has been planned and what has been the purpose. Now, also the IRA or national tax allotment, now they call it national tax allotment. Of course, from our end, we will release that as mandated by law and based on local government code, release that and with automatic release, given that we cannot hold or have a liens on that to hold that, and that should be, of course, released to LGUs. But of course, the implementation of that is subject to, of course, given the fiscal autonomy of the different LGUs, so we leave that there. But of course, they are subject to what are the guidelines and even the monitoring, evaluation, monitoring, and at the same time, assessment of where the programs, projects, and even the funds that they have to use for the implementation of the program. So, meaning, we leave it to the local government units where they use, but of course they are subject to rules and regulations that's prescribed, but not just by the local government code, but also the national government. So I don't think they can use that for the purpose of election.
Thank you so much for clarifying po, Yusek Rolly. And now for the second question, and any of our panelists can take this, what tangible projects, programs, and urgent actions that can gear up the goals and objectives of the participating agencies can contribute towards full socioeconomic recovery with and without pandemic? So again, what tangible projects, programs, and urgent actions that can gear up the goals and objectives of the participating agencies towards full socioeconomic recovery with or without the pandemic? Let's see. Let me try to paste that in our chat box to help our panelists perhaps understand better what the question meant. Ma'am Cynthia, I think since you were already mentioning po kanina some of the plans in place po of DSWD, maybe you can very quickly rehash na lang po some of the projects that you have that will be implemented po in view of post-pandemic recovery here in the Philippines.
Okay, thank you. Actually, I already emphasized or highlight some of the key programs. So important is the National Employment Recovery Strategy. So this is for to accelerate employment recovery geared towards the restart of economic activities. This is one strategy of government. And then as far as social protection, so of course we have the Pantawid and other social protection programs of government. So I would not enumerate all, but I would like to highlight that there is a livelihood assistance grant under the Sustainable Livelihood Program. These are existing programs, and then we have the Kalahi Seeds. So more or less, these are the big ticket programs that helps towards socioeconomic recovery with and without pandemic. And there's so many social protection programs that we have, but time is short. You can open the websites of DSWD to view what are these programs. But I was mentioning the recovery cluster group, which has committed respective programs and projects. There are so many, but you can see it, find it in most websites in government. And of course, in the DBM website, you can find all the programs and projects with corresponding budget. Is it not, Sir Yusek Roland?
Yeah, Char, if I may add on the Cynthia, actually we have identified a lot of major socio-economic program of the government, specifically for 2022 budget, and a lot of it actually na-mention na po ni Ma'am Cynthia as far as DSW's programs. Now we'll go to probably one good thing that is good to mention is the National Health Insurance Program of the government, which has we have allotted around 80 billion pesos for that health subsidy program for insurance premiums. So another one is the universal access to tertiary education of the CHED. Just to let you know, also under the DOH budget, just to mention, also we have provided booster shots as far as for our next year, around 45.5 billion, but that is under the program operation. We even have an education assistance subsidies to from the CHED, the 30 billion. Social pension indigent senior citizens, as already mentioned, the Dole livelihood program. What else? The medical assistance to indigent patients of the DOH. The human resource health program of the DOH again, that is accordingly, they are provided with 17 billion respectively. And of course, we have also the development, reproduction, and delivery of learning resources of the DepEd, the computerization of DepEd, which provided with 11.6 billion. Emergency repatriation program, the DOLE, that's 11.2 billion. And there's a lot, in the proposed budget that as far as, and even in the regular these are some regular programs of the government that is being provided even before the pandemic, and now moving forward, even for next year's, we have been providing this one. So that's in my addition to what has been said by Ma'am Cynthia. Thank you, Char.
Thank you so much, Yusek Rolly and Ma'am Cynthia po. I think Dr. Kelly Bird is raising his hand, so I'll turn it over to you, sir, if there's anything you want to add.
Yeah, thanks, Char. Just to add in the sense of Asian Development Bank's support to the Philippines government's health response and economic recovery. So I would just highlight some of the programs and projects that we do have with the government that is sort of aligned, closely aligned with their goals, and particularly for recovery over the short medium term. So on our first one is on our health response. We've got 2 projects with the Department of Health that are helping to scale up that response to COVID, but also our vaccination program. And we have a $400 million loan, which is co-financed by AIIB for an extra $300 million. And we've under that loan, we've locked in contracts with Pfizer and Sinovac that are supplying over 60, somewhere between close to 70 million doses, and that's equivalent to 37 million Filipinos being vaccinated under that funding. Under our infrastructure response, we've got a number of projects that we're preparing for approval this year and next year, and it's linked to climate change as well and environmental environmental sustainability. So we have a project which is our tourism development project in El Nido and Coron, which is going to be investing in public utilities, skills training, and enterprise competitiveness in those regions. So that's helping to create a environmentally sustainable tourism development in those areas when domestic and international tourism, so to be well prepared when domestic and international tourism starts to recover. In our investing in people, we have just approved a youth employment program. And part of that is our Job Start Philippines, where we've helped to set that up with the Department of Labor and Employment. And that's helping young at-risk Filipinos find good quality employment. We're also now preparing another pilot project, which is funded under ADB grants, which is what we call Skills Up Net Philippines, which is a grants to a network of employers to upgrade skills of their workers, and that'll be in 5 sectors, and that's really designed as a pilot to test the efficiency or innovative strategies for workplace training, so funding workplace training to help address that increasing skills mismatch that we're seeing as a result of the pandemic. So that's some of the activities that we're supporting and working closely with the Philippines. I'll leave it there. Thank you.
Thank you so much. Yes, sir.
Yeah,
yes, sir.
I forgot to mention because Mr. Kelly mentioned about the infrastructure program. Yeah, the Build program is one of the banner program, of course, of this administration still to accelerate public infrastructure development nationwide with the end of goal, of course, knowing boosting the economic growth. What else? Increasing availability of jobs and livelihood opportunities, and of course, ultimately uplifting the lives of the Filipino people. So as far as the budget is concerned, we are continually providing allocation around for next year. We have gathered around 1.8 trillion. That is equivalent already to 5.3% of GDP. So this is really a big boost for us in order for us to implement our programs and PAPs, build programs to really boost the economic activities and even make jobs available to Filipinos. Thank you.
Thank you so much, Yusek Rolly. And again, thank you to our panelists, to our moderator as well for a very fruitful discussion. And unfortunately, we didn't have enough time to really go into the details, into the nitty-gritty, but rest assured that we will be sending out a post-activity newsletter, which will include all of the presentations, a recording of this webinar, and a copy of a survey that we will be circulating to everyone who have registered. At this point, I would like to invite Mr. Colin Christie, the President of the Analytics Association of the Philippines, to provide a very brief synthesis of the presentations in the panel discussion that just occurred. Mr. Colin is an international executive, a serial entrepreneur, a global connector, educator, and digital leader. He is a co-founder of the Analytics Association of the Philippines and serves as the president of its board of trustees. Thank you so much, Mr. Collins, for gracing us with your presence today, and I'm turning over the floor to you.
Thank you very much, Char. I know we just have very limited time, so I think what I'll do is I'll just highlight the things that I found to be heartening in this discussion, some of the items that maybe give us pause, and then some thoughts about what was uncovered in terms of action plan. So first, in terms of things that are heartening, well, first of all, the event itself and the collaboration and cooperation between all of these various groups, led by UNDP in this, and then the involvement of all of the various partners that are here today. I find it very heartening that there are in-depth discussions happening around the use of data and making decisions based on data. Of course, we're from the Analytics Association of the Philippines. Love to see that, and it's encouraging. But not only that there's now innovation happening because of the need for speed. So it's great to see the innovation that's being applied to these two studies that are being reported on today. And what I heard from both the speakers and the panelists was broad agreement that it is very useful, that, for example, the use of the FMCG data, for example, is very useful. And so that's great to see. I think in terms of things that give us pause, you know, as was mentioned by Ms. Lott and also underscored by Dr. Kelly, you know, whenever we hear about the negative impact that's happening to people, and especially women and children, around health, around safety, around violence, you know, that definitely gives us pause. We obviously need to be sure that that's a priority, and I heard a lot about the programs today that are trying to address that. And I also highlighted in my notes what Dr. Lott said, quote, we need to take a more critical approach to the notion of resiliency, you know, that we're in a precarious situation. So I think, you know, that also, you know, motivates the need for speed in making these policy decisions, you know, based on this data. I also heard about the idea of integrating the findings with the other sources of data and other programs and analysis that's happening within the public sector. So I think that's really important. And then finally, I think in terms of action, well, first of all, I would, on behalf of the Board of Trustees of AAP, thank you for including us. We would like to just extend the offer of assistance to all of the folks here, all of the public sector folks, the NGO folks here, that, you know, what we're trying to do is build a really healthy ecosystem for data science and analytics in the country. And as such, we have a stakeholder group that we've built up that bridges not only public sector and academia, but also the private sector as well. So I think my thoughts in terms of action is that let's see what we can do to get as much help and assistance from the private sector in understanding what these findings are, and then also with the media. The media, of course, plays a very important role in taking these learnings that are taking place and disseminating them, because it affects the overall conversation. And we want to see that the conversation that's taking place publicly places high value and importance on the message that's being discussed here today. So I think I'll just end there by with that offer of assistance from AAP, and thanks very much for including us. Thank you very much.
Thank you so much, Colin. Again, you know, this is the biggest challenge in all of the webinars that we've been hosting, is to summarize such packed and insightful discussion. So thank you so much for that. And now to formally close our program, we will now all hear from Undersecretary Christian Ablan from the Presidential Communications Operations Office. He is Undersecretary for Administration, Finance, and Freedom of Information. Mr. Yusek Ablan, is a lawyer by profession and holds degrees in public policy and national security administration. He represents the Philippines at the International Conference of Information Commissioners and is active in open government and other transparency initiatives. Welcome, Yusek Ablan, and turning over the floor to you.
Thank you, Char. Good noon, everyone. Thank you to the UNDP for inviting me to give the closing remarks today. It is an honor and privilege. We had a very insightful and engaging discussion this morning about deepening socioeconomic recovery for COVID-19 through innovations in data and policy, organized by UNDP, Zero Extreme Poverty Philippines 2030, and Analytics Association of the Philippines, as the office designated to promote the sharing of government data and information to the people and public. We at PCOO found the studies very useful for our collective advocacy. Access to information has traditionally been confined to transparency and accountability efforts in the Philippines. But FOI is more than that, and the research presented today just showed us that data and information from government can be used for CSO and private sector engagement, leading to better policy making. More importantly, and relevant for today, how government data plays an integral role in our pandemic response and recovery interventions. What's so interesting in this morning's presentation is the use of non-traditional data to supplement government data. I'd like to commend Yemi and her colleagues and researchers at UNDP and Pintig Lab for using, number one, official statistics, particularly quarterly national income accounts indicators from the Philippine Statistics Authority and consumer expectations survey from the Bangko Sentral ng Pilipinas, together with non-traditional datasets, particularly fast-moving consumer goods or FMCG from Nielsen Market Research and community mobility reports from Google, and converge them to assess how COVID-19 has impacted Filipinos across different socio-economic groups. It was brilliant. We in government have relied almost exclusively with our datasets and statistics. I hope my colleagues read this study and consider using non-traditional datasets in the future when planning, budgeting, and making policy. The other research presented by CAPI on behalf of ZEP and UNDP Accelerator Lab showed us how CSO and private sector-led survey collection using chatbots are useful for decision makers seeking up-to-date data. Shout out to our friends over at AI4Gov for building the chatbot. You guys have come a long way since Hack4PH with the Tita Juana PH chatbot in 2018. Congratulations. Like I mentioned earlier, government usually relies on government-collected data. While these are reliable, they are sometimes not up to date. For example, we at FOI-PMO partnered with the Philippine Statistics Authority for the 2019 Functional Literacy Education and Mass Media Survey to have baseline data on the level of functional literacy and awareness of Filipinos concerning FOI. Results have been revealing, but we must consider that some insights may not be timely anymore given the pandemic situation. Nonetheless, we are very grateful to the PSA FLEMS team for all their work in collecting and unpacking the data. Moving forward, we may consider using chatbots like the COVID Plus survey sometime in the future to gather real-time data. I also appreciate the insights shared by the invited resource persons during the panel discussion moderated by Doc Ligot of AAP. To close, rest assured that our doors and windows in government remain open to further collaboration and establishing convergence from all sectors to aid in our country's fast and immediate recovery from COVID-19. May these findings be our call to action triggers for us to do more and improve on our approaches as we drive our pandemic recovery strategies forward. On behalf of UNDP, Zero Extreme Poverty Philippines 2030, the Analytics Association of the Philippines, the other organizers, the panelists and moderators and hosts, and my colleagues from the Philippine government, thank you for joining us. Mabuhay, take care, and God bless.
Thank you so much, Yusek Ablan. And again, thank you to everyone for staying with us. Before we close, we would like to make sure to remind everyone that, again, a recording of this webinar will be available to all of the registered guests and attendees. And we will also be attaching the presentations to that newsletter as well. And as we tackle this pandemic together, let us all keep in mind that we have to work collaboratively in the pursuit of a sustainable socioeconomic recovery that cascades to those in the fringes. And thank you again to everyone for such an insightful morning. The reports that were unpacked and presented will be available online starting this afternoon. So please anticipate that as well. We will make sure to circulate that to all of our panelists, to all of our speakers, and all of our attendees. Once again, this is Charlene Balaan of the UNDP Philippines. Thank you again for joining us this morning, and we will see you at our next webinar series. Maraming salamat po. Stay well and stay safe.
Thank you. Thank you, everyone.